They may owe money to a drug dealer, things like that. It's not uncommon to hear a family member mention that the drug dealer is threatening or making noises because they haven't been paid or whatever that situation happens to be. It's
Hmm.
very scary to be a parent
Hmm.
of an addicted person and not knowing what to say to them. Do you
You're listening to When God Intervenes, the podcast where faith, hope, and healing come together for families with a loved one battling addiction. Hey, I'm Daryl Rogers. I'm your host. I'm back here and I'm with Bobbe McGinley from Scottsdale, Arizona. Right, Bobbe, is Scottsdale?
correct?
Bobbe is the clinical director with Recovery in the Pines. And I was just looking a little bit about you online earlier, Bobbe, and I saw that you did the 55-week program with Hazelden,
I did.
and then you moved to Arizona, right, and started your practice there. And Bobbe is a drug and alcohol counselor, and also you do work with people who have a gambling problem, right?
Correct. That's
Okay.
correct.
And I saw they had 22 years with that, and have done some work with airlines and railroads. And the airline part was interesting to me because I have an aviation background.
Okay.
So, well, Bobbe, why don't you just go ahead and whatever I've missed, fill us in and give us a little bit of an intro and tell us how you got started in your line of work and kind of the things you like about it while you're doing it, and we'll just go from there.
Okay. Well, like you said, I completed the Hazelden 55-week counselor training program in 88, finished it in March. I think March 16 of 89 was the graduation. And that summer, actually in May, end of May, I was approached to take a job in Arizona to be the counselor at a women's extended care facility. And that's how I got to Arizona from Minnesota. So I worked for that particular agency for about 3.5 years. And then I worked for Charter Hospital in Glendale for 5.5 years. I was the addictions program director. While I was at Charter, I had a woman, so I was running the inpatient substance abuse unit that also did detox. And a woman came in and was admitted to the hospital because she was very, very inebriated, but she was also talking about wanting to die. And so my director asked me to interview her and see if she was appropriate to be on my unit, which was unlocked, or did we need to admit her into the other adult unit, which was locked for her safety. And in the conversation, she shared with me that she got drunk because she'd lost her money at one of our local casinos. So I knew at that point she did not need to be in the locked unit. I just put her to bed and let her get sober and then ran her through the treatment with my other alcoholics and addicts that were in the program at that time. That was my beginning of working with gambling. So I've actually been counseling now since 1989 or 88, actually, because it was on the job training, which is over 30. How many years is that now? 30.
35 years, I believe.
Okay. And
Yep.
then 27 years working with problem gamblers, somewhere around in there anyway.
Hmm.
And in year 2000, I opened my own agency to treat gamblers primarily, although I work with substance abuse as well, because there wasn't anyone really paying attention to the gamblers or the family members for that matter, who sometimes are in worse emotional state than the gambler themselves. So that was 2000, January of 2000. And in the meantime, I did become clinical director of Recovery in the Pines in Prescott, Arizona, which is a Christian men's substance abuse treatment program. I'm also currently the clinical director of Birch's Health, which is a telehealth agency. So I do online counseling as well. And you mentioned about the airlines and stuff. So I am the acronym, I hate the acronym, it's SAP, but stands for Substance Abuse Professional, where I do assessments, referrals, and follow-ups for different industries. And the airlines is one. It could be it could be a mechanic works with the airline, it could be a flight attendant works with the airline, it could be a pilot that works for the airline, and everything in between. I work with the Union Pacific Railroad. I have contracts around the country with EAP agencies that work with companies in Arizona, and their folks might be randomly tested for whatever reason or self-report that they have an alcohol or a drug problem, and they might be referred to me for assessment, referral, and follow-up. And I also work with commercial driver's license per DOT standards. So I have an interesting book of business. I mean, there's absolutely nothing boring about what I do, I don't believe. But one of my primary facets is the fact that I have a contract with the state of Arizona Division of Problem Gambling to work with gamblers and affected persons, and I've had that since year 2000. So that's where that population is coming from, or we're able to help
Okay.
them at no cost to them or at a copay because insurance doesn't cover it. And of course, gamblers reach their bottom by getting into a lot of financial issues, a lot of debt, losing homes, cars, families, and, so they
Mhm.
get pretty devastated in time. So, yeah,
Yeah, I can imagine. We talked earlier before we started about PAL, a little bit about PAL, and I facilitate a PAL group that I've been facilitating here for about 7 years. And then you told me that you know Mike Speakman,
I
and
do.
yeah, that's really neat, and that you were good friends. So tell me a little bit about what you know about PAL and a little bit about Mike, if you can.
Okay. Well, I met Mike when he was working for the Salvation Army, and he's had an interesting path for himself and just recognized something that no one else was actually talking about, and that is the effects of the family members when there is someone who is abusing or dependent on alcohol or drugs. And when he decided to focus on that, he went all the way. He started the PAL groups, and which is now a corporation. I mean, they're in, I don't even know anymore how many different states are actually running PAL groups for folks in the community. Yeah, he's got a board of directors and everything. I mean, and when Mike was first talking about this, he had me come into a couple of groups and talk to folks because, of course, I work with families as well and young people. And so I've been there supporting him at least, not necessarily actively involved or anything like that, but supporting him since it was an idea to do something on behalf of family members. And Mike's the kind of guy that gets on the phone and says, "Hey, Bobby, you got a minute?" And of course, and then he just runs ideas by and picks your brain a little bit, and then he takes off. So he's just
Okay.
very unique, forward-thinking type of individual. I mean, he's
Yeah.
amazing as a counselor and as a friend.
And for the viewers, I don't know if I mentioned or not that PAL is Parents of Addicted Loved Ones. It's a peer support group for primarily for parents. Any family member or friend 18 years or older who's affected by an addicted loved one or an addicted person is welcome at the meetings, but it's primarily geared towards parents.
Yes,
And it's based out of Arizona. I don't
it
remember
is.
where in Arizona. It's you know the city in Arizona is it
Well, I want to say Phoenix, but I don't know that.
Phoenix, that's right. It is Phoenix. Yeah, that's correct. My audience is mainly parents and mostly the mothers, not just the moms. But um, can you what tips would you have for parents that you think would be really good tips for parents that just they've already discovered their son or daughter is addicted. Maybe they're fairly new to this, but or maybe they're down the road just a little bit. But dealing with a son or daughter battling drug or alcohol addiction, what kind of advice would you have, or what kind of tips could you share?
Well, one of the things that I would recommend is that they go to the website, and I think it's pal.org, if I'm not mistaken, because there are different facets of that particular website that has assignments on it and questions that they can ask themselves that makes it feel a little bit more like they have some knowledge when they're reaching out and asking for assistance or for help or for support or even some coaching. I think one of the things that family members, moms, dads get caught up in is they don't know how to express what they're up against here. It's not natural for an adult to feel that helpless about something that they don't know or don't understand. And so, as many resources as they can pull, if they can't get to a PAL group immediately, is to go to the website and read that information, answer some of those questions, get some formulated process, and then start reaching out, making calls, going to groups, getting on board with a counselor if that's what they think they need. Even in
Mhm.
some cases, depending on the situation, there may be some financial ramifications of their young person with their drug use. They may owe money to a drug dealer, things like that. It's not uncommon to hear a family member mention that the drug dealer is threatening or making noises because they haven't been paid or whatever that situation happens to be. It's
Mhm.
very scary to be a parent
Mhm.
of an addicted person and not knowing what to say to them. Do you say anything? Do you wanna make them mad? I mean, parents automatically think if they confront, they're gonna make them use that it's gonna be their fault the next time they take a drink or take a drug because they're upset
Mhm.
with them, and we
Mhm.
really don't have that kind of power. And I would just say if a parent could have the power to force their child to use or drink, then they would conversely have the power to tell them to stop immediately, right? So
Mhm.
you look,
Mhm.
that's a quandary there. When you look at that realistically, it's like, well, no, I don't have that power, so I don't have the other either. So, garnering a lot of resources, I think, is really the thing, and information.
Yeah.
As much information as possible so that you can ask some of the right questions and get your needs met right away.
Yeah. Yeah. And I'll put the web address up there for people to be able to see. There are PAL groups that meet in person all over the country. If there's not one in your area, there are several online groups
Right.
that are out there, and you can find an online group to join. So there's plenty of ways to find PAL, and there's other good resources out there. Attending a PAL meeting does give parents access to other parents who maybe are a little further down the road and
Exactly.
can give them some pointers on a few things, and it's really a great program.
And I would also add that in my experience, I've seen, parents be very, very emotional, and so they are not they're afraid to go into a group because they might cry. They're afraid to make a
Right.
phone call because they're gonna cry, and I just wanna say, please let yourself feel what you're feeling so that you can start healing as soon as possible. Don't hold it in, don't hold back, just reach out as soon as possible.
Yep. Absolutely. Yep. I hear a lot of parents say that they have a child that has like a co-occurring issues. They have the drug or the substance use problem, but then they also have mental health problems. And it's hard to tell. Did the drugs cause the mental health issues, or were they underlying before, and that's why they started using the drugs? I guess at the end of the day, it doesn't really matter. But they're trying to figure out the best course of treatment, and then I hear recently, for whatever reason, in my PAL group, I've heard some parents talk about borderline personality disorder, and I know a little bit about that. I guess let's take it one thing at a time. If you could just speak about the some of the mental health, the co-occurring issues, and anything that you can shed some light on there would be good.
Well, I think the primary, would be either depression or anxiety.
Mm-hmm.
Another indicator with young people and alcohol and drug use is whether they are attention deficit disorder or attention deficit hyper disorder, ADHD, ADHD, attention
Mm-hmm.
deficit. Yeah, okay. And, if that's an underlying issue, that's one of the reasons why they might be using, besides peer group pressure. Parents seem to think that they should have realized something was amiss long before it actually became an overblown problem in the family, and There is a little bit of truth to that, but the other reality is whether you knew it from day one or you knew it at day 100, taking care of yourself is as primary as taking care of your addicted loved one. And parents sometimes end up very, very sick as a direct result of feeling helpless and hopeless about
Hmm.
helping their young person. If they become clean and sober through treatment or group, or I mean, some young people can get clean and sober through 12-step groups and not necessarily need detox or an inpatient program. But once they're clean and sober, then you're able to actually determine what the underlying issues are. And you're right. I mean, did the anxiety and depression or anything happen before the drug use and they're using that to medicate, or does it
Right.
happen as a result of the using? And it's, either or.
Right.
I mean, it's really hard to, pinpoint even a number on any of that, except
Mhm.
to say that only when we're clean and sober can we really get down to the reality of what this person is going through and what they're feeling and trying to pull that together and then find the best course of action for them. But they need to be clean and sober. I mean, how do you know? If you see someone that has been drinking and they're crying, are they depressed? I mean,
Right.
I don't know. I mean, yeah, it's
That's right.
depressing even to witness that, right? But can you actually diagnose them as depressed at that moment? So they need to be as clean and sober as possible in order to figure out what else is going on. And sometimes young people have medical issues that they are, physical medical issues or concerns that they are using alcohol or drugs to conceal or to manage. And we don't know that either until they become clean and sober. And
Right.
it,
I'm so glad you brought that up because I've had that conversation with parents before that, are you sure about the diagnosis? Because, were the drugs out of their system, when they were diagnosed? Are you sure, about this particular mental health diagnosis? A lot of times the answer is no. And then what you mentioned about ADD, ADHD, that's another thing. It's just experience with me, but our son was diagnosed ADD early on, not ADHD, but I think, the psychiatrist, he only got a small snapshot. I
yeah,
saw the hyperactivity. I saw the impulsivity at times. Most of the time, I will ask parents, especially if it's a young male, if their child is a young male, have they ever been diagnosed ADHD or ADD? And it seems like 95% of the time, the answer is yes. So there's definitely a correlation there.
yeah.
You know?
It's a pretty big number, I would suspect.
Yeah, yeah, absolutely. So I know with our son, when he started college, he was playing football and on Division II level, and he did not want to be on his ADHD medication or ADD medication and he was on Concerta, a low dose of Concerta,
Okay.
and just a little bit of Ritalin, to help tie over. He took himself off of his ADHD medication because he realized it was suppressing his appetite and he wanted to get bigger for football.
Oh,
But pretty soon after he took himself off, his doctor said self-medicating, and which makes sense to me. That's when he started with the substance use. Any particular oh, we talked let me go back to the, borderline personality disorder and bipolar. I think I get the difference, but if is that something that you see come up every now and then, and can you talk about that a little bit?
well, I see the bipolar more than anything else, uh,
Mhm.
in young people. But you can't really tell whether it's that because of the anxiety and the depression
Right.
and the very up and down mood swings as opposed to these kinds of mood swings. I mean, we all have ups and downs. One minute you're really happy, and the next minute you think about something you didn't do yesterday. So now you kind of your moods come down a little bit. That's very natural. But for someone with bipolar, it's an extreme high and they get very manicky. These are the individuals that would clean the house in an hour. And then the lows are so low that they can barely get out of bed if they can get out of bed at all in bipolar. So that looks really different too, even when an individual is drinking or drugging at that point in time. You can
Mhm.
be able to tell something is not quite right.
Mhm.
And I don't wanna speak a lot about the borderline thing
Okay.
because, I'm not a psychiatrist or psychologist.
Okay.
For if I suspect anything like that, I refer my clients out,
Okay.
okay? And don't actually and I'll work with them, but I'll work with the psychiatrist and whatever else they're recommending. But
Okay.
I did wanna touch on the fact that when you realize when a parent realizes that their child is in distress due to alcohol and drugs, to please not forget the other children in the home. It's
That's
one
a
of
really
the
good
things
point.
that is very damaging to the other kids is when all the focus is on this one individual, rightfully so, but it really needs to be divided, and the other kids end up being overly responsible for each other. They sort of become the parents instead of the children, and it can be damaging in ways that we're still trying to figure out at this time. So, I just wanted to throw that in before our time was up today to make sure
Yeah.
parents remember the other children and give them as much time as they possibly can, on top of trying to help the individual with alcohol and drug addiction.
Yeah, that's a really good point, and if it's an older child that is over 18, I mean, if you're trying to decide whether they need to stay at home or whether they need to go, I mean, if they have younger siblings, if they can move out of the home, if you can, one way or another, that's usually the best thing, in my opinion. Would you agree with that?
It might be, depending on the case.
Yeah.
In some cases, they wanna stay closer to help out, so
Uh-huh.
it's hard to determine, but yeah.
Yeah, yeah, case by case. I get it. In terms of treatment, do you have any kind of recommendations, just in general, for parents about the types of treatment programs that are better, or how long should treatment be, things like that?
Well, that's a valid question and a difficult one to answer
Mm,
because it's tailored to the individual, I
yeah.
mean, some individuals require a 5 to 7-day detox and maybe they can go home. Other individuals require 30 days inpatient treatment to get away from the environment, their dealers, their friends, and all of that good stuff. And other people need longer term treatment. And then after that process, then they might require another couple of months in an outpatient capacity. So, for instance, Recovery in the Pines is a 6-month to a year commitment
Mhm, mhm.
in Prescott that I'm the clinical director of, and it's fabulous. It's a Christian program for men and women, but what it does is it gets them to a point where they are self-sufficient. They're clean and sober, they're self-sufficient, they've got jobs, they're connected with their spiritual whatever their foundation happens to be up there. They're regaining respect and community with their peers. They're gaining respect with their family members and their parents. I mean, it's just it's a character building program for them to be the best that they can be. And some people thrive in that environment and other folks don't require that much. It all depends on what they're using, how long they've been using, and what it looks like when you actually meet them. In other words, if an individual is in a marijuana-induced psychosis, a 2-week program is not going to be sufficient. They're not even
Right.
talking in sentences yet, in some cases. So it would all depend on the individual,
Mhm, mhm.
on what would be recommended for them, the best course of action. But I would recommend for the parents to really study the program that they may be putting their loved one in, ask a lot of questions, get information, if possible, visit, interview staff, interview other parents if you can. It's not as high anonymity process with parents of loved ones as it is with the patients themselves. So it would be awesome to interview someone that went through the program, but you can get a great deal of information from their family members. But just do the homework, I think it's absolutely incredible. Enlist some professionals to help you out with that, either an interventionist or another counselor or a pastor, to give you information and support, but just list questions. I'm all about writing things down. If you have a question, don't try to remember it, because when in the course of a conversation, we start talking about different things, and then when it's over, you go, "Oh, I forgot to ask this," or "I meant to mention this." And parents get very confused because this is all about emotion in this
Yeah.
distress. It's all about the trauma for them at that moment. So write things down. What are your questions? They'll all make sense. Don't worry about it.
Hmm.
Parents go,
Hmm.
"I don't think I can make any sense of this." Well, ask the question. Ask the question. Information is power. We gain it that way, right?
Yeah, really, really good point. Really good point. All right, Bobby. I think that'll wrap it up for our interview, and it's
Okay.
been great having you here,
Thank
and
you.
really appreciate it. Thank you for tuning in to When God Intervenes. If you found today's episode helpful, please subscribe and leave a review. Your feedback helps us reach more families in need of hope and healing. For more resources and support, visit our website at thefamilyrecoverycoach.com. Until next time, stay strong and keep the faith.